Welcome everyone. Welcome to Webinar 3, Clinical Notes. I'm Katrina Otto, a practice management consultant and medical software trainer with my own business, Train IT Medical. This evening's webinar is brought to you by AHPA, Allied Health Professions Australia, and it is the third in our series. AHPA is also providing recordings of these webinars free of charge for you all. And those recordings, as well as this one tomorrow, will be available from ahpa.com.au or my website, trainitmedical.com.au, where I have created a page called Free Resources Allied Health Providers, and we are going to continue to add more resources as they are created. In webinar 1, we looked at medical software, and we actually engaged with 34 allied health software vendors to try and ascertain what features they currently offer. So that was in webinar 1. From that webinar, we created a spreadsheet of current software available for you. And I based that criteria, prioritized on what you had said to me that you wanted from surveys, from your associations, and from my own experience working with and teaching many software products across a range of health disciplines, pretty much since software first came in. So please know we are not endorsing any of these particular products, and this list is not all products. These are the software vendors who engaged with us. We do encourage any other vendors out there who feel they should be on this list to get in touch. And as you can imagine, this spreadsheet, given the rate of technology change, will stay current for about 5 minutes. But AHPA, which is wonderful, as you can see there, has kindly agreed to continue to update and expand the spreadsheet. So it's a valuable resource for those looking for software and particular features, some of which I will talk about tonight. So all the vendor contact details are there too. You can ask them any of your discipline-specific questions, because we do have 467 allied health professionals logged on tonight, and you do represent the complete range of disciplines, which is just wonderful. So what you are seeing on the screen here is a snapshot from that spreadsheet with some of the clinical features and then whether the particular software offers that feature. I'll be talking about some of them tonight, some of these clinical features here: customizable progress notes, templates, diagrams, scanning, using shortcuts. And obviously with more than 34 products, I can't show all the features in each product, but the idea is to work out your next step. Go back to the vendor or product if you already have software to go from there. So our learning objectives are on the screen now. You would have seen these when you registered. And I know, as I said, from your registrations and feedback, we have a full range of different allied health professionals attending, and you are at very different stages of computerization. My personal challenge, my goal is to best meet your specific learning needs and help with the next step. And I know from the registration, some of you have already taken that first step and have software. You may not be using much of it or be happy with it. Some of you are looking to improve efficiencies, and I absolutely applaud you all for that. Improving practice efficiency is what I do for a business. So that's why I'll be talking tonight about those time-saving features like shortcuts, templates, progress notes that auto-populate, etc. For the past 20 years, I've been teaching how to create clinical notes and how to move forward with computerization, so we're meeting the standards and protecting you as practitioners as well as the patients. And of course, the number one goal is usually in my life is for clinicians to minimize the typing but improve documentation. However, I know also that most of you attending tonight are not yet using any medical software. So this is why I particularly wanted to include this fourth learning objective. And I moved it from number 1 because it is such a significant one. So if you already have clinical software, after we've finished number 3, you can go and have a dinner. Yay. But for those of you who are just looking to get software to incorporate a computer into your clinical consultations, this has been a very big focus of the development tonight. And what I have done is I've actually created pretty much a separate presentation that will play after this. I too live in a world of technology challenges. I wanted to show you a video, however, with nearly 500 people online, it's going to be much safer if you watch that video in your own time afterwards. So what number 4 involves, just so you know, is what I call a fabulous success story. So as I said, I've been working in practice for 27 years. I hear from all of you that you have really varying ways of working, including very physical consultations. So I did spend the first 5 years of my career working with psychologists and social workers, and where a patient is sitting and you have a computer, a tablet, or a desk even, they are not quite the same challenges as a physical consultation or a home visit. So this is where I thought I may need to provide additional help. How can we make the process easier for you all? So what I did was I accompanied a occupational therapist on a home visit. Her patient Pam kindly allowed me to video them, and I interviewed Brooke to find her tips for success about making that change, because it is a very interesting story and a very good success story. Brooke has been occupational therapist for 30 years, and after 27 years of handwriting her notes was told she had to use a computer. So massive change. And in the video that will follow on from tonight's webinar and be available for you tomorrow, that is where we share all the tips for how that played out. And it's I think a lot of you will resonate with the challenges and hopefully also with the strategies for overcoming some of those challenges. So that video will be after this webinar tonight in a separate YouTube video for you. And as you can see there, Brooke's comments, she didn't grow up in the computer generation. I didn't either necessarily, but some of us are much more interested and in computers than others. And it was never, I've known Brooke forever, and it's never been on her radar, didn't even have an iPhone. So great success story. But we'll move on tonight and we'll talk first of all about using the software, and then we'll come back to those changes, because I think it's really important to actually design some workflows that are going to integrate that software in your consultations with your patients. So what I've got on the screen now is an excerpt from the RACGP standards on consultation notes. So I know you all have your own associations and your own standards, but I think these are really good guidelines. I mean, they have to include the clinician name, the date, the reason for the presentation, the findings, diagnosis, management plan, preventive care, referrals, advice. And you'll note down the bottom here in A, it says who conducted the consultation and whether that was noted with an initial in the handwritten notes or an audit trail in the electronic record. So that sort of reminds me to nag you about, with computerized records, always log on as yourself. Protect your password. That will protect you, because computerized records are an excellent audit trail. Everything is recorded. And it's very much about, for me, minimizing risk. My role as a practice manager is about minimizing risk, saving time, improving the clinical and practice benefits. So we all know if it's not documented, it didn't happen. So how can we minimize your typing time, minimize your computer work generally, really, so you can spend more time with your clients, which I'm sure that's what you want to do. So let's look at those things we call shortcuts and templates. And this is all about ensuring that we have good notes with minimal typing time. And I often find clinicians write in abbreviations. And when we talk about shortcuts in software, we're usually talking about abbreviations. Basically, we were talking about typing a couple of letters and the meaning will display. So I'll just open best practice now. Now I'm not as I said, going to be able to possibly show all the different software. I do train a few software best practices, one of them, which is here on my desk. So I'm going to use that one tonight. So the idea of this software is that it's what we call single point data entry. Clinicians might call it single thought data entry. You put the correct information in the correct place and the progress note is populated. So for example, if your patient has a diagnosis, then that would be entered a reason for visit. So you will remember in those standards, they said it must document who saw the patient, what day, what time. That's automatically done, even whether it was a surgery consultation or another type of consultation. So also, if we collect a reason for the visit, so the reason for the visit, I know there's a lot of podiatrists watching tonight, so I thought I would include I've got a bit of a focus on occupational therapy, and last time it was physiotherapy. I'm trying to reach all the different disciplines, but I can't possibly. Let's go with the foot check tonight. So the idea is that you use the inbuilt tools from the software, and that will automatically populate your notes. Even tools like the observations, which I just clicked on at the top of this screen, even that would allow you to not only populate the software, but also to do wonderful things, helpful things like graph over time, those changes. So the idea is, what do you wish to collect in your software? The tools of the software where we can use them. So a good example is you're seeing patients with significant conditions. The past history list, for example, this is what we call coding. In general practice, doctors have to code. This is a national diagnostic list. It has fabulous benefits to that coding. That's why we do it, because we can then do things like manage our patients with certain conditions, chronic condition management, and being able to say, well, these are how many patients we have who have this condition, who are, on this medication, or who also have this condition. So say you are seeing a patient and they have been diagnosed with diabetes. We would type a few letters, choose it from the list. Much quicker than free texting, and also free texting doesn't have the benefits of enabling us to search for things. So we could also write in here, who was that who diagnosed that? Who are the other people in that patient's healthcare team? So the idea is we can collect information in here, document that, and it's also going to have, let's edit that, the date. So it's also going to have a benefit of being able to, well, we can include that in the patient's documents, the letters, if you're writing reports. So today's notes, being able to collect information without typing would be by using the tools included in your software. The benefits, of course, being able to report and manage. Well, how many people who have diabetes have we done a foot check for? Or how many have significant other conditions? Often in general practice, we'll do searches of how many patients have diabetes who also have depression, or how many patients are on certain medications. So the idea of coding in the software, entering the information in the correct place, helps from a patient population management perspective, and at times a business management perspective, because one of the things we do need to be is really smart about how we're managing our patients, and even how we're billing, and how we're educating too. So the idea is collecting information, using the tools to create your progress notes. We've also, as we saw, got down the bottom, a reason for visit. Foot check is not a diagnosis, so you've got to, if you're making a diagnosis yourself. We've also got something that I call shortcuts. A lot of us call shortcuts, and in each software they may have a different name, but in best practice they're called autofill. So the idea, and it's even built into some of the software. So if I just typed HX, one of your common abbreviations, and hit the space bar, it's going to put that shortcut in. That's a shortcut. Okay, so and even that SOAP protocol, subjective, objective, that's O colon, A colon, P colon. So we take that concept of being able to just type a couple of letters and have more entered, and we can create our own. So as an example, one of the things that you might be doing often, you can create into a shortcut. So advised of importance of having feed assessed every 6 months or more often if problems are identified. So if that was something that you were typing commonly, then you could create a shortcut for it. And if you wanted to use it, you could just access it from here, autofill, find it on your list, and you could insert it, or you could type it. Type whatever your shortcut is, hit the space bar, and that's going to enter all of that text. So this is really, really a massive time saver. And no doubt you do type common text commonly. So the tips for creating them, I always say if you've typed that 3 times, create a shortcut. And you could, if you've typed it, copy it, select it. So click to highlight, copy what you want, select what you want to copy, right click, copy, go into autofill, add, right click, paste. Now the hard part is giving it a name. So I might do a different one. I might do it as another example. I'll do one of the ones that came up a lot when I was shadowing Brooke. It's a cognitive assessment. So she does this on all her patients. So the idea is that would be quite easy. Cognitive assessment shortcut. So save it, close. CA, easy. Now, once you've created one, autofill. Now, most of your software, hopefully, will have this feature. And these are the questions to ask if you're actually choosing software, and if you're using software and it doesn't have it, how can they match it? So the idea is you start pretty small, you start with something like that, and then you might build to, you know, patient could articulate, what can they articulate? Day of the week. Okay, now if you put on the keyboard above the 6, Shift and 6, that's a little symbol, and it will allow you to stop there. Oops, Prime Minister. So I'd be going, what other questions do you ask? And so on, and you could build it like that. So the idea is to create a little, I guess, a little format for how you work in your consultations. And my little tip here is, I don't know, probably CA is a medical abbreviation for something. I wish I could ask, but no doubt it is. Every time I want to use an abbreviation, it means something else. You know, CP, I know CP is. I always want to use CP for care plan. So the little tip is to put a full stop before it. I can't take the credit for that. A doctor taught me that, because doctors always want to call them PAP and wax and ERTI and flu. But the idea is you're going to type that shortcut to get your detail to enter. So you don't want to accidentally type it in the middle of a sentence one day. So you're never going to accidentally type a full stop. So the idea is full stop, CP. Now, if you don't want to share with others in your practice, don't tick that box. If that's an option in your software, just think about that. Does everybody want your fantastic shortcuts? Usually I find people don't always like them. Now, these little carrots, they're called here, these are Control and F5, enables you to go to that and you can enter those variables. Could they state the day of the week? Yes. Who the Prime Minister was? No. And then you could put some detail. Remembered previous Prime Minister. So just as an example of my typing. So the idea is, in a progress note, hopefully those shortcuts are going to help you by minimizing the typing and certainly enabling you to have repetitive and often really important things like what have you warned the patient about? What risks have you discussed? What consenting has taken place? And sometimes I do work a lot with the indemnifiers, so consenting is a big part of my world. So the idea is you could even put consent for whatever it was that you discussed, examination discussed, patient said. Put in the patient's own words. Oops, excuse my typing. So yeah, just an idea. So much better than that. Goodness knows what that says. So the idea is use your coding for your diagnosis, use the shortcuts, and then if something doesn't fit into a shortcut, consider a template, because those of you who did watch webinar 2, and that recording is still on the website if anyone's interested, but one of the things with templates is that it can pre-fill information, and then it can populate with the patient's name and the patient's demographics. So really handy. So you can type, you can use the shortcuts, you can use templates and forms, and we also have features like diagrams and drawing tools. And this one will automatically have your spell check, so you probably would like that. So we've got the spell check up here, and you can, if you wanted to, even make things different fonts and look better. Because if you think about it, the efficient way, really, if you're taking a lot of good information in your progress note, then what you would maybe want to consider is I could just put that straight into a report back to the referring GP without too much extra work, without too much extra typing. So think about what you type commonly. Could you create a shortcut? So I did a couple of foot ones in preparation for tonight. The idea is wherever you are in your progress note, if you don't remember what they're called, autofill, find it there. And then, as you can see, this one is quite detailed. So we can go Control and F5 and we can go through that assessment. So depending on what you're wanting to do, you can take a consultation and you can modify it to minimize your typing time, but actually to create pretty good progress notes. If you have forms that you would like pre-populated as a template, we have the options here in our letters, which is that plain paper icon. We have the option here to be able to create templates, and that should be in any software that you choose. So this again, I'll be thinking, I'm a bit biased, but I'm thinking shortcuts and templates are essential features if I was looking or recommending software. They're kind of essential, I think. Not sure how you would work as efficiently without being able to customize a little for yourself. I know there are very specific software. Optimate comes to mind for optometry. So the idea is, but I know from working with you all that even within disciplines, you all work quite differently. So an example here is templates. You could have that foot assessment template you could have here as a favorite, and you could fill it in like that. And obviously I just did that in 5 minutes, just put it in there, but you would actually have it even more sophisticated and populating that information and asking you questions. You save it and you're done. So the idea is it's automatically populated your progress note, and a copy of that is saved in your medical software as well. So the idea of templates really fast, and I always say, I teach a workshop called Towards a Paperless Practice. Pretty much everything in the practice can be either a template, so that would be the criteria if it has patient information that needs to go into that. So let's take the foot assessment and plan here. So the idea is, you would have patient or information, or this, let's take the report to the referring GP. You've got, who am I sending this back to? And that's your address book that we explored in webinar 2. The conditions that are in your patient records that you entered, and specifically each patient's detail has populated this. So this is an example of a template. It's a report back to the referring GP, and it's automatically including today's progress notes. And because the idea being, it's a lot easier to take something out, so highlight it and delete, than it is to retype everything. So if you want the template to populate with patient information, that's in the template area. If it's a form, then that would be in the patient education leaflet section. So you've either got information that is, you just want to print it out and you want the patient to fill it in. So typically, as it says there, patient education. But if you have this as example, you may have just a consent form that you're just keeping in here, or you might have patient education information. It comes with information, and this has got the Beyond Blue stuff. This is really good. We've also got health share information in a lot of the software now, but just depends on which software you're using, what features they have. So again, something else to look out for, which is your patient education. So the idea being to create good clinical notes, we can access the features of the software, and we can actually generate and save information for yourself. So as you can see there, I've put that foot assessment checklist into the education section, so I could just print it out and give it to the patient. A lot of the software has features also, like, for example, your K10, your mini mental state. So when you are looking for minimizing your typing and creating good notes, the idea is, well, what features are in the software that I've chosen, and which ones could I automatically use to enable that to populate and also measure over time. So templates, and we've also got the ability to save patient education in a lot of the software, hopefully most of them, I would imagine. And we've also these days got some flexibility, I've noticed, with the software, insofar as the TM2 I noticed has touch screens. There are abilities to do drawings, and best practice would be an example. So in the progress notes, if I look over here on the right hand side, I can go into the skin section and I could find a picture of a foot. So it is, I could find a picture of anything pretty much, but let's go with the foot. So drawing is very important for a lot of clinicians. How you do that, I've worked with a lot of musculoskeletal clinicians, and that this is a big challenge area when choosing software for a lot of people. So the idea is I can click on that and I could choose a drawing tool, and I could put something on there. I'm not very good at drawing, sorry. Nice, lovely wound. So save the diagram, save it, there's the foot. And then you could make some notes about that, of course. So one of the things that we have is, as we said, the ability to be able to quickly generate. So I'm just going to quickly generate a report back to the referring GP, new letter. Now these are just, it's an example of this software has a feature where you can save your favorites. So I'm going to go there. Who am I referring back to? Find your GP or your clinician from the list, include the information that you wish to include, and then it's a massive foot. You could just tweak out what you don't want in that. And as we learned in the last webinar, using secure messaging, we can just hit send, and That's the secure messaging feature that general practice has to use if they're accredited practices. So the clinical notes will look different in each software, but these are my tips. So this is what I'd be looking for in order, as you saw there, to really streamline some of those efficiencies with the documentation. So drawing tools, importing the diagrams, and also populating the templates with your notes. We also should have the ability to anything that has come into the practice, anything the patient brings in with them, we should be able to scan into there. And I'll talk about that in just a moment. So there's an example of Clinico. There's an example of Power Diary with the different features for notes. And MediRecords, they actually allow sharing some or all of the patient notes with the patient electronically if they want that. So each product will have varying options and some of the discipline-specific ones. So Core Plus allows, upload an image of your own, have various drawing tools. Many work with devices these days, which is great for portability. So I'd definitely be looking at the clinical notes features they include, and do they support shortcuts and templates would be top of my list. So it's part of general practice that we do communicate electronically. So one of the features, and I was thinking within a letter, you even have that ability within a letter to hopefully have shortcuts as well. So in this software we do, in the software I train, they all have this ability to be able to have shortcuts. So maybe an example of a shortcut might be, telling others that you are able to communicate electronically. We are happy to receive reports electronically. And then what do you use? So the idea is anything that you're typing commonly, that would be a good shortcut. And if you think about it, I bet you type a lot of common text commonly. It is important when you're creating those shortcuts, though, to ensure they have those little carrots, those little upside down V's, to ensure that we are changing it for each patient. Now, when we talk about scanning, we do live in a world of paper. So I'm very big, as you probably figured out by now, on sending things electronically. If we send it electronically, it's received into the software electronically. So not only is that a good business and financial saving, because we don't have to pay staff to scan, but it's also a confidentiality improvement, because when documents are floating all over the practice, we're not doing everything we can to protect privacy. So we do still, of course, have a lot of paper, and we scan that in. So when you receive referrals from other healthcare providers, when the patients bring information in with them, when you handwrite your notes or your drawings, your financial and procedural consent forms, this is probably this is a paperless practice, because there's no paper files. It's just paper ready to be scanned. So this is how I feel working in general practices. So I guess you're figuring out by now why I'm so big on computerized records and not having your reports coming back also in paper form that then somebody has to scan. So if scanning is new to you, I'd recommend designing a process around it as a team, including all staff who may be involved. Ensure that there's no possibility for one of those documents to be scanned without you having seen it. So scanning is very easy. Look, I'll just show you just how easy it is. So correspondence in is just what this software calls it, documents, letters, reports, what the other software calls it. And in here, correspondence in, I would just hit the scan. So it will activate the scanner, and I will actually stop that because it will, and it will make a noise, and scan. And that's it. And then you would label it. So when you label it, it would look like that. and then when you double click on it, it would open it. So scanning is really easy. We can also, import documents. So if you were taking clinical photographs, or if your scanner actually saved onto your hard drive, then you could actually scan from there. So the idea is, what is it? Who's it from? There's your address book. And I won't go too much into that. But the idea is I could do, what is it? I didn't pay any attention to what it was. So there you go. And now, there it is. These. So out the door. Now this is, so that, as you can see, very easy. However, hopefully, we will have a bonfire of the faxes. We will, in the next few years, or certainly before I retire, be sending information to each other electronically so that you have it instantly available. And in general practice, there is a lot of information that's sent electronically, or the results are sent electronically these days. So it is about efficiencies. What I just showed you now, for those general practices who use this software best practice, this is not how they do it. This is a very simple demonstration of how you can scan, and you might do that. But in general practice, there is a lot of scanning, and there are admin staff to do that scanning. So one of the things I'm really mindful of is you don't all have admin staff necessarily who can do a whole lot of scanning. So hopefully I'm thinking of ways all constantly to how can we save you time and how can it be less work for you, so that we certainly don't want to create more. I always say scanning, we lost filing, we got scanning. Still a chore. Let's now aim to eliminate scanning, and by eliminating scanning is when we have information going electronically. When that information is sent electronically, it all comes back into one place, whatever your software is, and then you open that and you access that. And that's where it's really important to have a clear system built around that for your practice to minimize risk for your patients and ensure efficiencies. So hopefully that's not your practice. And if you are using paper files, it might be a case of a gradual transition to electronic records. And at the moment, we're working towards building resources to help you with that. So your path to paperless, as I would call it. So which documents do need scanning? And also practices who have been doing this for a while, they are now doing things like setting their fax up so it automatically saves those documents in files. So therefore, we don't actually have to scan them. We import them, as you saw I just did before in best practice. However, to minimize risk, we've got to keep up with that scanning. As I said, if somebody else is doing the scanning for you, it can't be 2 days or 3 days, because there might be something there that you really need to see. So what does your path to paperless look like? I mean, everybody is different. Do you know? I'll tell you a story. My GP, my own GP, who I absolutely adore, I've been seeing for nearly 25 years, she handwrites her progress notes. It's what we call a hybrid system. She uses the software quite well, actually. I mean, my health summary, if I was to look in here, my health summary would be populated, and my medications, my allergies, my past history, it's all in there. My results, it's all in there. But this detail here, she still handwrites some of that, and then they scan that page in. So her path was to gradually increase use, and we've been doing that over the past 10 years, gradually increase use. I think she has really, really, good progress notes. And next step, of course, now is that she won't need that anymore because there is more and more being entered in the computer. But, it's a path, and everybody takes their own path. What really worked well for her was to create a shortcut in here. And that shortcut said, if you can imagine, maybe there wasn't much in there. And what she did was she said, see scanned progress note. So that told any of the other 14 doctors in her practice that if they're looking back at this visit, that they needed to go and have a look at the scanned document. So that was an absolute essential to minimize risk. So she created a shortcut which saved her typing time, and that was her path to slowly getting rid of the progress notes. She thought that was wonderful when we did that, and we would put full stop PN. So when she did that in a patient file, all she had to do was go full stop PN. Everything else was done in the software, so the medications, but just the details of that progress note, everybody needed to know that they would be scanned into here. That's where they needed to look. So they do say there is more risk if you do half and half and you're working in a practice with other clinicians. And it was actually the fact that she was with other clinicians that was the motivation on her path to the next step, because she was fearful that the practice would fail accreditation. So everybody's path is different, and this brings me to the other fabulous success story I did promise to share. And I have been making this video that I will have for you. And as I said, ideally I would have liked to be able to show it in this webinar, but with nearly 500 people online and bandwidth, I know that that would be a technology challenge and I would hate for it to fail. So this is what I call a disaster management plan, and every good business owner needs to have a disaster management plan when it comes to technology. So I didn't want to take the risk that playing a video in this context may be slow, may not work. So I have pre-recorded that video for you. I also am going to put it on YouTube, and for any occupational therapists listening, I think it'll be of particular interest. But anybody really who is making the transition might identify with some of these concerns. These were Brooke's concerns because, as I said, after 27 years, Brooke went to work one day and it was handed a laptop and they said, you must use this. There is no choice. So I think in particular with physical therapists, that's very real. The fact that, patients could fall and hurt themselves or worse. So this is also a factor. Brooke has worked for 30 years in both Australia and America over that time and trained countless occupational therapists. It is about efficiencies. We need to have billable hours. And most importantly, she wasn't happy about even the idea of compromising on the care. And she had beautiful handwritten notes, I would say. So it's a really, really, I think, interesting success story, because somebody who didn't want to change, who had serious concerns, and she talks about how she uses the screen and has, I must say, after observing beautiful rapport still with her patient, integrates the use of the computer, but it doesn't detract. The way you position the computer, adjusting the time you enter the computer versus the time you engage with eye contact with your patient. I've watched GPs do this for the last 20 years. You can do it really well or you can do it really poorly. So the idea is to have a planned approach, learn how to incorporate that computer well. I mean, we all, I'm sure, know people who complain that their doctor spends too much time looking at the computer, but you can do it really well. And I think the video shows Brooke doing that. So how long did it take OT Brooke to adjust from 27 years of handwriting notes to paper? It was 3 months. It took every one of those days of those 3 months, but after that time, she wouldn't go back. She created a dialogue. She would say to patients, I don't have a good memory and I need to document things, so I'm just going to type a little bit. She looks at patients, she engages with them, she's warm, and makes sure that she looks up regularly when typing. So it is really one of the things I've noted over the years from working with doctors who do this well and also observing Brooke is the importance of explaining to patients what you are doing and why. Brooke has this lovely dialogue when introducing the laptop to the consultation. She maintains excellent eye contact, warmth, gives the patients ample opportunity to say this is or isn't all right. And I know from practice management and training receptionists, that whole idea of assessing and judging and being constantly aware of patients, whether they're not okay with something. And that's what we do at the front desk as well, assessing if patients are, a bit agitated about something. You would do the same if you were introducing a screen. And in the video, Brooke talks about the fact that sometimes she can't use it and doesn't, and how she manages then. So feedback from Brooke includes, this was what was new for me, working with clinicians who work in an office. It's not quite as challenging as far as how you can document with a patient. I work with psychologists who use their computer throughout the consultation, dietitians, speech pathologists, sitting. But when you're physically working with a patient, then it's about developing your own creative ways. And Brooke did actually say it really does depend on how good the software is. She told me privately that she refused to work at one place because she disliked their software. That was in America, that was in Australia. So one of the key things must be charged up and ready to go every morning. So practical tip there. And templates, Brooke has worked with software that didn't enable free texting in those documents or templates and found that really limiting and really frustrating. So that's probably a shout out to the vendors listening tonight as well. Good feedback from users. So what she thinks 3 years later, and this, staggers me. These are the comments. Made me faster. Okay, so, and it is in a multidisciplinary environment. So Brooke talks about the fact she works with physios and speeches. She works with dietitians a lot and also consultant psychologists, obviously the surgeons. So it is subacute care and rehab. It is very, very important to be able to have good information at the point of care. So stops me from missing things. To me, that screams medico-legal risk management and patient safety. So the other thing that she reminded me of was that a lot of allied health professionals take work home to do. They take their notes home to do. And she doesn't do that anymore. And I would really like that for you all as well, that you didn't have to take your work home with you at night as well to finish those notes. So I will leave you here with a few of my tips, things that you will observe also if you watch the videos of Brooke and I. So this is about including the screen in the consultation. I'm not even young, but I want to see what's on the screen. I want to be included in my health conversation. I would actually even like to have a copy of what's been written, what's been said, and hopefully, down the track, I will be able to share the actual whole entire medical record. In the meantime, I can certainly share with summaries, and that's something I'm going to be talking about next webinar on digital health and my health record. Providing training, I cannot tell you how often as a software trainer, our efficiency comes down to knowing how to use the tools that we have and using them well. A lot of people in my life change software programs, and I find it's quite often because they didn't know how to use the one they had, and changing software is a massive decision for a practice. So use that screen information to facilitate discussion. Ensure that there is that mix of face-to-face. So I'm sure most of you want to be just face-to-face talking to the patient, but we can include a screen into the conversation as a way of empowering patients. And tablets, even better. They've enabled us to do that even better. I also interviewed a speech therapist, and these were her comments about the benefits since moving to computerized records. And I like this one in particular, that is significant when dealing with diet change. So being able to communicate across a team. This is something that, are really going to, I personally don't think we do very well in Australia yet. And I think we're going to see improvements and see a much greater need to improve efficiencies with sharing across the patient's healthcare provider team. So what's your goal? From a practice manager perspective, a business management perspective, I would just add in there that computers do give us data. That's how we can improve our businesses, be smarter about our businesses, maximizing our revenue, of course. I often find clinicians work very hard, don't maximize their revenue. Manage the risk. Good documentation, being able to find information, have up-to-date information at the point of care. And really, it will save you time. And your time, what I've learned from working with allied health professionals, is you don't value your time enough. You are important. So the goal is that, whatever efficiencies technology can bring to your practice, the focus is on, it is on improving the outcomes for you and your patients. This is the future. There is an app for that. So our patients have screens. They are part of the consultation now. They will Google, prescribe an app for them if you are in a allied health discipline where that's appropriate. Share information so that they have access to that themselves. And that's what I'll be talking about more in next month's webinar, sorry. I have included also another list of links and page of learning resources, in particular focused on those aspects that you may just want a little bit more information about, such as, well, what are the rules about collecting consent? I talked tonight about using a shortcut to collect consent versus having a signed, printed document with consent. There's some information about financial consent from the AMA and from the indemnifiers. And MDA has some information on photographs. All their websites are really good for further learning about standards in health and also the RACGP standards. So thank you everyone for attending. Please know that this recording will be available by tomorrow afternoon on my website and soon on AHPA, as well as the resources that we are creating. Thank you for sharing your time with me tonight, and I hope that tonight was some beneficial tips for you. I look forward to speaking with you again soon, and please don't hesitate to connect with me or AHPA, and I look forward to speaking with you again soon.